is Kidney Cancer Awareness Month, and we are kickstarting a webinar series on kidney cancer. Uh, we have with us today Dr. Kumar Saurabh, who's consultant medical oncologist at HCG Curie Cancer Institute, Ranchi. And we have with us Dr. Chinmaya Kumar Pani, who's at Apollo Hospitals, Bhubaneswar. So today we will start with a discussion on kidney cancer, knowing your signs and symptoms and risk factors. And, as this is part of a series, so we will continue on this throughout the month. Really, the point is for people to know that it is not to be feared, it's to be understood and managed well. A quick reminder, PatientsEngage, for those of you who are new to the platform, is a platform for patients dealing with chronic diseases and caregivers to share their experiences and learn from each other as well as from healthcare professionals. And we really want people to know that if they are better informed, they will make better choices, and they're not in this alone. There are people who are there to support them. And we've always put patients and survivors at the center of all of our discussions, and our learnings and our questions come from our conversations with patients and caregivers. As I said, we have with us Dr. Kumar Saurabh and Dr. Chinmaya Kumar Pani, and we are very, very privileged to have them with us. I am Aparna Mittal. I'm founder of Medical PatientsEngage. And this session is being supported by Merck and Pfizer. It is in the interest of public awareness, and it does not substitute a medical consultation. The sessions here, the answers or the information that is being provided by the doctors is for spreading general awareness and may not always reflect that of the platform or the sponsors. We are going to go through a series of predefined questions, but if you have specific questions during the session, you can share on our Facebook Live as well as YouTube Live, and we will pick them up. You can contact us. Otherwise, you can always contact us on our social media channels. We are on Facebook, Instagram, LinkedIn, Twitter, and YouTube, or you can reach us at editor@patientsengage.com or the website patientsengage.com. So let me get started because we have a lot of ground to cover. Kidney cancer is not a very well-known cancer. People hardly talk about it, but it's not that rare as well. So let's start with Dr. Saurabh. What is kidney cancer?
Kidney cancer is basically any cancer which affects the kidney. And generally, it can affect any age group. There are a variety of cancers where kidney is involved in young pediatric population, like Wilms tumor being very common. And in the older age group, in the 60s age group, we have something called as renal cell carcinoma. And so kidney cancer basically is cancerous mass which arises from the kidney, and it affects both the extremes of age. It can occur in children as well as it can occur in older adults.
Right.
And if you have a hereditary predisposition, you can get it at a younger age in the young adults population also, 20s, 30s, and all.
Okay, thank you. Dr. Chinmaya, what is the function of kidneys and how does cancer affect its functioning?
Okay. So, if you were asking me the functions of the kidney, the first function is the first is about the excretion of the unwanted products. Maintenance, specifically the salt and metabolites metabolism, it helps. Apart from these two, it has an important role in vitamin D metabolism, manages the calcium and vitamin D proportions in the body. It has a role in erythropoiesis, which regulates actually the hormones that is erythropoietin for blood making, for hemoglobin synthesis. So these are the basic functions of the kidney, means excretion metabolism, maintenance of the homeostasis or the body balance, that is the balancing of the water and salt, and also metabolism of the calcium and other part. This is one part. So when actually kidney tumor happens, it affects these portions,
functions, right?
these functions. That means the excretion is inhibited. So you have elevated urea and creatine. You have altered renal function. You have altered sodium and potassium. You have altered calcium, and you have anemia.
Right.
So it structurally and damages. It also functionally damages.
Right. Thank you. So coming back to you, Dr. Saurabh, you talked of hereditary being one of the risk factors for kidney cancer. What are the other causes and risk factors for kidney cancer?
Okay, the usual suspects. The number one will be smoking. So smoking is one of the major risk factor, as not only with kidney cancer, but you can name any cancer in the body, and smoking will be a risk factor. Apart from that, hypertension is again a risk factor, very common throughout the population, and it is considered to be one of the major risk factors. Obesity, occupational exposure. So somebody who is working in, let's say, asbestos industry, cadmium industry, or someone dealing with petroleum products, they have exposure to some toxic compounds which may lead to kidney cancer. Then people with chronic pain syndromes, can be osteoarthritis, can be rheumatoid arthritis, or musculoskeletal pain, who continue taking analgesics, painkillers for a pretty long period of time. They damage their kidney, and in future they are at risk for getting kidney cancer.
Right.
Then we have something called as cystic disease of the kidney. So the cystic disease of the kidneys are inherited, mostly in most cases, but can develop incidentally also. And again, these patients will have increased risk. Then those patients who have a liver infection, hepatitis C, so these patients will have. Then there is a subgroup of patients who suffer from sickle cell disease. It's an hereditary disorder, especially common among people in Sindh area, Gujarat and all. So these people develop kidney stones, and finally may go on to develop kidney cancer also. And one specific subgroup is there where anybody who had a childhood cancer for which he had received chemotherapy. There are multiple childhood cancers. So these cancers are most of the times curable. So these patients do get cured with chemotherapy, but their chances of developing other cancers, including kidney cancer, later in life are high.
Right. And since you mentioned obesity, hypertension, are patients with, and this is back to you, Dr. Saurabh, are patients with CKD also at chronic kidney disease also at
So
risk of?
any patient who is having a chronic kidney disease will have a higher than the general population risk of developing a kidney cancer.
Right, right. Dr. Chinmaya, you talked of how the cancer affects the functioning in terms of elevated various levels, factors in the blood. But typically, apart from, if you can just summarize the signs and symptoms that people should watch out for.
So, honestly speaking, there is no perfect telltale early sign to whom you can detect the cancer in a much earlier stage.
Right.
So we lost the opportunity actually to detect the kidney cancer at an earlier stage of what we detect in cervix and in breast. That's very unfortunate to say. Point. The point very, very to be taken very, very seriously. Point number one. Point number two is that if a patient having gross hematuria, while you are examining for some other reason, accidentally you found that there is a increase the size of the kidney. And in case of a child, while the child is taking bath, the mother accidentally detected any form of mass in the abdomen. And if there is any kind of plant pain, And sometimes it happens that in case of male, there is a unilateral testicular swelling. Testicular swelling happen in either the left side or the right side. So these and of course and pelvic pain. So these are probably one of the not so early sign and symptoms, but these are I could enumerate as warning signs and symptoms, so that you can evaluate eventually and subsequently, and get it evaluated very quickly, as quickly as possible.
You mentioned hematuria. Can you explain what is hematuria for a layperson?
Okay. Yes. Hematuria means it is in the blood, in the urine. So hematuria can be macroscopic. Macroscopic means you can see in the naked eye, or it could be microscopic, that your lab person will tell that it is hematuria. So the hematuria can happen at the initiation of urination, or hematuria can happen throughout the urine, and hematuria can happen at the end of the urine. So what happens in kidney cancer? It is the hematuria pattern is throughout. There is no specificity that it will happen in the early, not happen in the late. So this is the one of the very specific feature that I can say that everybody should be aware about, and it's a point of concern, definitely.
Right. And is it, you've talked already, Dr. Saurabh, on the age groups it affects typically. Is it more common in men than women?
Yes, ma'am. If you see the epidemiological data, kidney cancer is basically happens predominantly in males. It is 2:1 ratio. So it's not like that females will never suffer from kidney cancer, but it's more a disease of men. The reason basically not known.
Reason not known. Okay. And it's the difference in age is both in the children as well as adults?
Adults, generally, if you see the childhood cancers, which is mainly Wilms tumor, generally they present within 5 years of age.
And that's also more in boys than girls, or it's in both?
More often in boys, but the difference is not that marked as in the older age group. And older age group, generally the average age for a kidney diagnosis is 60 years, above 60 years, but it can happen after the age of 45. So we do see a lot of patients who are in their 40s and 50s also, but generally it's in the predominantly affected age group is more than 60.
Right. And Dr. Saurabh, are we seeing a growing concern? I mean, is the incidence of kidney cancer growing in India? And which is the more common type of kidney cancer in India?
So, yes, if you see the incidence of kidney cancer, it is growing, though it is not as common as oral cancers or lung cancer, which are or breast cancer. But the incidence is slowly and surely growing, mostly not related to the genetic factors which I have mentioned. It is more related to the lifestyle disorders.
Right.
And your other question, I just forgot.
Okay, we'll come to that separately, because let me first start with Dr. Chinmaya. What are the types of kidney cancer, and which is the most common type of kidney cancer in India?
Yeah. So typically, if you'll ask me the type of the kidney cancer, the first, let me little bit of elaborate you. The first is if the cancer is happening inside the kidney, then it is a kind of adenocarcinoma. Then if it is in the renal pelvis, then it could be a transitional cell carcinoma, or rarely it could be a sarcoma. So mostly, conventionally, we call kidney cancer when it is happens in the renal tubules, means it's the adenocarcinoma. So if we focus on the adenocarcinoma variant, from that we can subdivide into two categories. One is clear cell and non-clear cell, very broadly. So mostly it is clear cell, 60 to 70%. It is very typically clear cell, and rest are that of the non-clear cell. So needless to talk so depth into so much of scientific variants. So in this way, we can classify the kidney cancer into two segments, and renal tumors into another three subgroups.
Right. Thank you. And Dr. Saurabh, Dr. Chinmaya already talked of the challenges of warning signs and symptoms, but what are the diagnostic tests that are used to detect kidney cancer? And, is it possible to detect in a blood test, or does it require other procedures?
So generally, the investigation of choice to detect a kidney cancer is either a CT scan or an MRI. But you will be prescribing a CT scan or MRI only when you have definitely, because CT scan will expose you to radiation. So if somebody comes with an abdominal mass and some clear-cut symptoms like hematuria, I mean blood in urine, so I believe, and you don't want to give him radiation exposure, ultrasound is a okay modality. But the investigation of choice, if you tell me, it's a CT scan to detect and diagnose a kidney cancer. The important thing in kidney cancer is that any mass which is solid mass, we have a few radiological features where the radiologists can tell by looking at the scans itself that whether it's a kidney cancer or not, given the age group, if it is happens in an older age group. So the important thing is not to go for a biopsy in a case of non-metastatic kidney cancer. So if you have a kidney mass which is looking like a cancer, ideally the patient, it has to be excised. So any solid lump in kidney more than, let's say, 3 centimeters in size, needs to be excised, because more or less it should be kidney cancer. So the reason why we don't do a biopsy is to avoid seeding of the tract of the with the tumor.
Right.
So that is one thing which patient should also know, that yes,
So
biopsy
this
is not
is one
required.
of the few cancers where a biopsy
Biopsy
is
is not required.
not recommended
Early stages.
in the
In
early
early
stages.
stages.
Only in early stages,
Only in early stages.
where surgery is the treatment modality of choice. Yeah.
Okay. So when you say early stages, that means it's what stage? Only stage 1, or it could be even stage 1 or 2?
So that
Up to stage 3. Yeah.
up to stage 3, it will be very simple. Any operable kidney cancer is early stage. So
Right.
if you are operating and curing it, it's an early stage.
Right. So Dr. Chinmaya, if you can explain the stages of cancer, kidney cancer as well.
Yeah. So basically, first you have to think that it is confined to the organ, kidney or not. Then if it is confined to the organ kidney, then probably what is the stage of the tumor, and radiologically what Dr. Saurabh already told, what is the nature of the tumor, whether it is a solid, whether it is a cystic, then you stratify it. So possibly it is a tumor or not. Then second,
Right.
if you are contemplating that it is a tumor, then you analyze what the size of it. So based upon the size, then you evaluate whether this is T1 or T2. Then whether the adjacent organ specifically is involved or not, whether the fat, the perineal fat is involved or not, any lymph node structure nearer to the stem of the connecting dot, the stem of the kidney, whether they're involved or not.
Right.
Then for that reason, you have to know, and you have to do the Doppler to see the venous flow, whether any venous thrombosis associated with or not. This is because very much important to know the venous thrombosis is there or not there. So this is then if the lymph node is involved, it is coming to the stage 3. Stage 4, when the bone or the lung or any other distant lymph node, liver, maybe ascites, maybe fluid in the abdomen, if it is there, or in the brain, if it is there, then it is possible you are dealing with a very advanced disease, that is the stage 4.
Right. Right. And Dr. Saurabh, how, is kidney cancer typically fast growing, or only some cancers are fast growing? And how do you determine whether a cancer is fast growing?
Basically, there is no clear-cut answer to this. Depends on the histology, depends on the genetic factors, and depends on some of the things which we don't know. Per se, the science doesn't know. So kidney cancers can be slow growing. You can have a kidney cancer where the patient says that he has been having this lump for, let's say, 4 years, 5 years, and it is confined to the kidney. And there are some aggressive variants also, especially sarcomatoid variants, which Dr. Chinmaya had already illustrated. So these are the aggressive variants of kidney cancer, and they are very fast growing. So by the time the patient presents to your clinic, already is in stage 4. So there is per se, there is nothing like any hard and fast rule. So you can have slow growing kidney cancers, you can have fast growing kidney cancers.
Right, right. And typically, does kidney cancer always affect both kidneys, one kidney? What is the norm, Dr.
Most,
Chinmay? Okay, go ahead, Dr.
Acha,
Saurabh.
sorry.
No, no,
Okay.
go ahead, Dr. Saurabh. It's okay.
So most of the times, kidney cancer will affect a single kidney. It will not affect both the kidneys. So treatment per se is very easy when we are able to diagnose it at an early stage. So either a partial nephrectomy or a total nephrectomy will suffice, because the patient will be having one kidney to survive.
Right, right. Okay. So, you've kind of pretty much answered the question of, is surgery the best option for kidney cancer? So for up to the point it is surgically operable, then surgery is the preferred option. When surgery is not an option, what is the choice of treatment, Dr. Chinmaya?
Yes. Specifically, if the disease is in the stage 4 and it has been extensively involved various organs, that means brain is involved, liver is involved. So multiple organs are involved, and it's in a very short course of time. Means you are detecting the disease, and at the same time the disease is with high volume. Means it is involved to various organ, maybe possibly more than 2 or 3 organ. Brain is involved. So in such conditions, whatever may be the biology of the disease, we tend to avoid surgery, because adopting the surgery at this stage will not impact the survival. It has
Right.
not reflected that doing surgery will getting any survival benefit, I mean to say. So in such segment, we try to avoid the surgery. There are some proportions of cases where the surgery is indicated, and that is when the kidney is involved and any single organ or low volume disease is involved outside of the kidney. Still in
Sorry,
that
low?
low volume disease is there.
Low volume.
Low volume means very less amount of disease there in the lung. So only lung is affected, and one portion of the lung is affected. So 1 or 2 nodules, up to 3 nodules are there in the lung. In such conditions, still you can venture to go ahead with surgery, but not when the disease is actually extensively involved, affecting the various organ, where actually doing the surgery may be of detrimental outcome.
Right.
So we don't tend to go for surgery in such cases.
Right. And if this, so it could be if it's not reached the lung, but it's reached one of the other closer organs like the bladder, etc.
No,
No,
okay.
go
So
ahead.
no. So basically, it is mostly of a resectable organ, where resection does not cause much harm,
Okay.
because by anyway we are not getting much benefit out of it. So
Right.
there are a lot of trial those who have evaluated going through surgery versus no surgery. Now everybody is adopting non-surgical policy, except the few cases where disease is localized, especially to the lung or the little bit of adjacent organ, where you can do surgery in toto.
Right.
Suppose
Right.
adrenal gland is involved, you can take out the adrenal gland and you can go for it. So in very smaller subset of patients, so mostly in 90% of cases, you are not doing surgery.
And do you also have cases where you've done, surgery is being done and then it's followed by, say, chemo, radiation, etc., like you have for some of the other organs?
Okay, so you were asking it's a stage 4 disease where you have done the
Or it could
surgery.
be early. So if you're saying,
Okay.
so let me clarify. So if it is
Okay.
stage 1 and surgery is possible, then there is nothing else that is required, or there may still be cases where it is followed by.
Let me clear. Okay. Suppose it's the stage 1 is there and you have undergone either a complete nephrectomy or you have done a partial nephrectomy. So that is the that is the procedure of choice. And after that, the patient need to be in close surveillance. Surveillance means close follow-up, and whether it has been whether or any other part of the disease is there or not. So periodically, you need to assess the patient for that. In the stage 2 disease, also that valids true. In the stage 3 disease, where the disease is went to the lymph nodal organ, and when the extensive lymph node involvement are there, there are some data now tending towards suggesting us to use targeted therapy or immunotherapy post-operatively, and they have shown little bit of benefit in non-recurring the patient. Means therefore they have reduced chance of recurrence if we are using it in the stage 3. In the stage 4 disease, post-operatively, if there is if you have operated everything, means the small tumor size, small tumor which is going beyond the kidney, if you have taken it out and there is no tumor, still at that point in time you can wait for some time the disease to you can wait for some time, because spontaneously there is some chance that it may cure it may control the disease for some time, but later on it will again come. But when the disease is extensively high and you are not undergoing surgery, at that point of time, your only option is to go for targeted therapy and immunotherapy. So that is how we are sketching the plan of the patient with the proper discussion.
Thank you. So, Dr. Saurabh, we've talked of the various treatment options. Obviously, we're now talking of more treatment modalities. How has kidney cancer treatment changed over the years, and have survival rates improved?
So, almost, if I can say with confidence, let's say almost 15 years back, a stage 4 kidney cancer. If you are diagnosing kidney cancer in early stages and your surgery is successful, I believe you do have a excellent shot at cure. But as I said, kidney cancer is a notoriously difficult cancer to detect in an early stage. So most of the kidney cancers which we get are generally advanced. And absolutely there were no, and kidney cancer is a chemo-resistant disease per se. The traditional chemotherapies, they don't work that well in kidney cancer. So just 10 to 15 years back, I believe the average survival for a stage 4 kidney cancer was hardly 1 to 1.5 years. But things have changed over the past decade. So we have new molecules, we have targeted therapies, as Dr. Chinmaya was telling, and the immunotherapy has also come in a big way in kidney cancer. So now we are seeing, on an average, the survival rates have almost tripled. So for a stage 4 kidney cancer, if the patient is having a good biology, a good responsive tumor, I have seen patients surviving for 5 years and more also. So that's a big leap. So anybody who is getting a kidney cancer, even though it is diagnosed in advanced stages also, need not lose heart. So there are molecules available where we can definitely prolong the life for a pretty long period. And plus these molecules come with a good quality of life. So the traditional side effects which were associated with the traditional chemotherapies are not there. So many of them are able to lead long and healthy lives with a reasonable good quality of life.
So you mentioned targeted therapy and immunotherapy. So is it similar to, say, lung cancer, where you do mutation testing to figure out whether these would be applicable, or that's not the way it is for kidney cancer?
No, that's generally mutation testing. We don't stratify the patient on the basis of mutations in kidney cancer. In lung cancer, it's like that. So not all targeted therapies will work in all lung cancers. But in kidney cancer, it's not like that. So we generally don't stratify. We generally, if the patient is fit, we generally start with a combination of targeted therapy and an immunotherapy. And there are second line options, third line options, and so on.
Right. Okay, thank you. There's, I think a couple of final questions. I know we are on the hour. For those who have a family history and maybe at higher risk for various other factors, what are the options available to them to be more vigilant? Is there anything they can do proactively or not really?
Uh,
Go
okay.
ahead, Dr. Chinmaya. Yeah.
Yes. So basically, as Saurav already told, 5 to 8% of the kidney cancers are actually inherited, and the pattern of inheritance has a little bit of complex. There are various other syndromes. That syndrome is there are various other symptoms associated with this kidney cancers make it a syndrome. So kidney
Right.
cancer, along with other disease, along with other features, other abnormality that usually sell. And this happens actually at an early age, and it has a familial predisposition. And if you do a proper family tree analysis, if you check, there will be certainly you find some kind of kidney tumor or some kind of other symptoms in the family or related to the family. So you
Right.
need to do the serious family counseling to find out and to do the proper genetic analysis to find out that what could be the cause of it and how to address the problem. So genetic counseling means you have to evaluate and dig into the family tree and
Right.
assess the patient and its family, extended family, and analyze the symptoms and find out that what it could be, and then you genetically evaluate so that you're focused on it.
Right.
Yeah.
Okay. Thank you. Um, Dr. Saurabh, any final advice? Because, it is Kidney Cancer Awareness Month. We are asking people to be aware of the symptoms and be vigilant, but not be fearful. So, what's your final advice to our viewers?
So I believe the first thing is that if you have a symptom, let's say the traditional triad of symptoms, which is generally not seen very commonly, but the triad which we used to study, is abdominal mass,
Mm,
pain, and hematuria, which is blood in urine. So if you have this triad of symptoms, it's definitely advisable to consult a urologist or a local doctor. And any abdominal mass, the point is what people generally miss, and which I generally have seen over the past 10 years of my practice, is that if you don't have pain,
mm,
then the people think that it is non-serious.
mm.
So this misconception is something which should be avoided. In fact, most of the most of the tumors, most of the cancers per se, be it
Correct.
breast or be it lung or be it kidney or whatever, generally they are painless to start with.
True.
So if you have a lump, if you have a suspicious lump in your body, it is always better to get it evaluated, especially if it is growing.
Right.
So this is one thing. And if uh, uh, by chance you are diagnosed with a kidney cancer, I believe there is nothing to lose hope. We have very good treatment options available. And if surgery is not feasible, then also you'll have a long and healthy life ahead of you. So it's not, you should not lose hope. That's all.
Right. Right. Dr. Chinmaya, your final
Yes,
advice?
yes. So the first thing that uh, keep a habit of whatever the problem you are facing, and you try to evaluate.
Mm,
Don't go away from the truth. If it is happening, you go. Increase your health sickness behavior. That always I say to people. Because always it is true that early diagnosis, roads to cure, that is what I believe, and that slogan valid for this. Because
mm,
if you check, if you diagnose it early, and there is possibility that you can diagnose it early if you're sensitive enough. Number one. Number two, that even if you diagnose it late, still never lose hope. Seek the treatment. Uh, uh, raise the means if you are don't feel yourself alone, you
mm,
speak out,
mm,
talk with the people, discuss with the people, go to the doctor, speak to your oncologist, and speak to the patient engagement team. I like the concept of patient engagement, what you
mm.
saw. So
Thank you.
speak to the team and uh, and apply your brain. Don't be emotional, because what happened, the cancer patients are very emotional, and they and there is this uncertainty come to their mind eminently, and there is a life-threatening thoughts come to them very, very rapidly. So avoid these thoughts. Be realistic. What I always advise: be realistic. Go to the doctor, speak to them, speak to the consult to the doctor, then adopt the practice, then take second opinion. So
Right.
you do that very meticulously. There are a lot of trials coming. Don't feel yourself alone. That is, I always say people. You should never feel yourself alone. Go
Right.
and talk, speak, create buzzer, put the alarm. Everybody is accessible in India. That's the beauty in India. Everybody is accessible.
Right.
So
Right.
take the help of people.
Thank you. Thank you, Dr. Chinmaya, Dr. Saurabh. And to our audience, I think quick recap. So I think first thing, as I think Dr. Saurabh said, one of the biggest risk factors is smoking. So please stop smoking as soon as you can. Take help from smoking cessation lines if required. There are these things as well. Stay healthy, maintain your, body mass index. And today is World Obesity Day. So reminder that it's good to not put on weight. Also helps you identify the difference between abdominal mass, for which would be cancerous, versus just weight gain. uh, Manage most of your NCDs well. Your hypertension, diabetes, they're all increasingly being seen as risk factors, and Dr. Saurabh and Dr. Chinmay also talked about it. And be aware of the symptoms of abdominal mass, blood in the urine, and obviously pain if there is any. Don't treat that pain as just backache or something that is will go away on its own. And I think the key message is understand and not fear, as Dr. Chinmaya said, that you know we all are too afraid to find out what's happening with us, with our bodies. But I think it is important to get an early diagnosis and be reassured. It may be nothing, but then you'll at least have checked it out, or you will get treated early enough, and that's the best thing that can happen. So thank you everyone for taking the time, and Dr. Saurabh and Dr. Chinmaya for taking your time on a Saturday evening to answer these questions for our audience. And thank you, Pfizer and Merck, for supporting this initiative as well.
Thank you.